Lower back pain is a widespread issue, particularly among seniors. It's a discomfort that can significantly impact daily life, making simple activities like walking, bending, or even sitting for extended periods a challenge. The causes are varied, ranging from age-related wear and tear on the spine to muscle strains and underlying conditions like arthritis. However, it's crucial to understand that managing lower back pain and improving quality of life is possible through gentle exercise. Regular, low-impact exercises can strengthen the muscles that support the spine, increase flexibility, and reduce pain. This textual piece aims to provide you with a guide to simple, safe, and effective exercises you can incorporate into your daily routine to alleviate lower back pain. Remember, proactive steps can make a significant difference in your comfort and mobility. We'll delve into specific exercises shortly. Before we dive into the exercises themselves, it's absolutely essential to emphasize the importance of consulting with your doctor or a qualified physical therapist. The information presented here is for general knowledge and educational purposes only, and it should not be considered a substitute for professional medical advice. Every individual is unique, and what works for one person may not be suitable or safe for another. Your doctor can assess your specific condition, taking into account any pre-existing health issues or limitations you might have. A physical therapist can then tailor an exercise program to meet your individual needs and abilities. It's also vital to remember that if you experience any sharp or worsening pain while performing these exercises, you should stop immediately. Pushing through pain can potentially lead to further injury. We aim to provide safe and helpful guidance, but your health and well-being are paramount, and professional medical advice should always take precedence. Now that we've established the importance of consulting with a healthcare professional, let's briefly touch upon the anatomy of your lower back. Understanding the basic structure can help you appreciate how these exercises work to alleviate pain. Your lower back, also known as the lumbar region, is a complex and vital part of your body. It's primarily composed of vertebrae, which are the bony building blocks of your spine. These vertebrae are stacked on top of each other, with intervertebral discs acting as cushions between them. These discs are like shock absorbers, preventing the bones from rubbing together and allowing for movement. Surrounding these vertebrae are muscles and ligaments that provide support and enable you to bend, twist, and stand upright. When these muscles become weak or strained, or when the discs are compressed or damaged, it can lead to lower back pain. The following exercises target these muscles and structures, aiming to improve their strength, flexibility, and overall function. Let's begin with our first exercise, pelvic tilts. This is a gentle yet effective exercise that strengthens your abdominal muscles and increases flexibility in your lower back. To perform a pelvic tilt, lie on your back with your knees bent and your feet flat on the floor. Gently flatten your lower back against the floor by tightening your abdominal muscles and tilting your pelvis upward. You should feel a slight stretch in your lower back. Hold this position for about 5 to 10 seconds, breathing deeply. Then, slowly relax your abdominal muscles and return your pelvis to its neutral position. Repeat this exercise 10 to 15 times. It's important to focus on proper form and controlled movements. Avoid arching your back excessively or holding your breath. The goal is to gently engage your core muscles and increase the range of motion in your lower back. This exercise can be done daily or is recommended by your healthcare provider. Moving on, let's explore knee-to-chest stretches. This exercise is excellent for releasing tension in your lower back and hips. To perform a knee-to-chest stretch, lie on your back with your knees bent and your feet flat on the floor. Gently bring one knee towards your chest, using your hands to clasp behind your thigh or shin. Pull your knee in as far as is comfortable, feeling a gentle stretch in your lower back and hip. Hold this position for about 15 to 30 seconds, breathing deeply and evenly. Then, slowly lower your leg back to the starting position. Repeat this exercise with the other leg. You can alternate legs or perform several repetitions on one leg before switching to the other. Aim for 2 to 3 repetitions on each leg. Remember to move slowly and gently and avoid pulling too hard. The goal is to feel a comfortable stretch, not pain. This exercise can be particularly helpful for relieving stiffness in the morning or after prolonged sitting. Next, we will focus on lower back rotational stretches. This exercise gently improves spinal mobility. To perform the stretch, lie on your back with your knees bent and your feet flat on the floor. Extend your arms out to the sides, forming a T shape. Keeping your shoulders flat on the floor, slowly lower both knees to one side, rotating your lower back. You should feel a gentle stretch in your lower back and hips. Only go as far as is comfortable. Avoid forcing the movement. Hold this position for about 15 to 20 seconds, breathing deeply. Then, slowly bring your knees back to the center. Repeat the stretch on the other side. Aim for 5 to 10 repetitions on each side. It's crucial to keep your shoulders grounded throughout the exercise. Avoid twisting too far, and listen to your body. If you experience any pain, stop immediately. This exercise is best performed on a firm surface. Our next exercise is the cat-cow stretch. This exercise is a gentle way to improve posture and gently stretch the spine. For seniors, a modified version may be more comfortable. Begin on your hands and knees, ensuring your hands are directly under your shoulders and your knees are directly under your hips. Your back should be in a neutral, flat position. This is the starting position. For the cat pose, gently round your spine towards the ceiling, tucking your chin towards your chest and drawing your abdominal muscles inward. Hold this position for a few seconds, feeling a stretch along your spine. For the cow pose, slowly arch your back, allowing your belly to sink towards the floor. Gently lift your head and tailbone towards the ceiling. Hold this position for a few seconds, feeling a gentle stretch in your lower back. Alternate between the cat and cow poses for 5 to 10 repetitions. Focus on controlled movements and breathing deeply throughout the exercise. If getting on your hands and knees is difficult, you can modify this exercise by performing it while seated in a chair. Let's move on to partial crunches, modified for seniors. This exercise helps strengthen your core muscles, which are essential for supporting your back. Lie on your back with your knees bent and your feet flat on the floor. Place your hands lightly behind your head, supporting your neck, but avoid pulling on it. Gently curl your upper body up towards your knees, lifting your head and shoulders off the floor. Focus on engaging your abdominal muscles to lift you, rather than using your neck or arms. Only lift a few inches off the floor. This is a partial crunch. Hold this position for a second or two, then slowly lower yourself back down to the starting position. Repeat this exercise 10 to 15 times. It's crucial to maintain proper form to avoid neck strain. Keep your chin slightly tucked towards your chest and avoid pulling on your head. If you feel any neck pain, stop the exercise. Remember, the movement should be small and controlled, focusing on the abdominal muscles. Beyond specific exercises, maintaining proper posture throughout the day is crucial for preventing lower back pain. Good posture helps distribute weight evenly across your spine, reducing stress on the lower back. When sitting, ensure your feet are flat on the floor or supported by a footrest. Your knees should be bent at a 90-degree angle, and your back should be straight with good lumbar support. If necessary, use a cushion or rolled-up towel to support the natural curve of your lower back. Avoid slouching or hunching forward. Take breaks to stand up and stretch, every 20 to 30 minutes. When standing, keep your shoulders relaxed, your head level, and your abdominal muscles engaged. Avoid locking your knees. When lifting, bend your knees and keep your back straight, using your leg muscles to lift the object. Hold the object close to your body. Avoid twisting while lifting. These simple postural adjustments can make a significant difference in reducing lower back pain. We've touched on exercises that strengthen your core, but let's elaborate on why a strong core is so vital. Think of your core muscles, your abdominals, back muscles, and pelvic floor muscles as a natural corset that supports your spine. When these muscles are weak, your spine is more vulnerable to injury and pain. A strong core helps maintain proper posture, stabilizes your spine during movement, and reduces the strain on your lower back. It's like having a built-in back brace. Besides the partial crunches we discussed, other activities can contribute to core strength. Low-impact exercises, like walking and swimming, are excellent choices. Even everyday activities like gardening or housework can engage your core muscles if you focus on maintaining good posture and using proper lifting techniques. Remember, consistency is key. Incorporating core strengthening activities into your routine will provide long-term support and relief for your lower back. Perhaps the most important piece of advice we can offer is to listen to your body. You are the best judge of what feels right and what doesn't. It's crucial to differentiate between discomfort and pain. Some mild discomfort or muscle soreness is normal, especially when starting a new exercise program. This type of discomfort usually subsides within a day or two. However, sharp, stabbing, or persistent pain is a signal that something is wrong. If you experience any of these types of pain during or after exercise, stop immediately. Rest and give your body time to recover. If the pain persists or worsens, consult your doctor or physical therapist. Pushing through pain can lead to further injury and setbacks. Remember, the goal is to improve your condition, not to make it worse. Progress slowly and cautiously, and always prioritize your well-being. Now, let's discuss how often you should perform these exercises. Consistency is key when it comes to managing lower back pain. However, it's also important to be realistic and avoid overdoing it, especially when you are first starting out. A good starting point is to aim for 3 to 4 exercise sessions per week. You can gradually increase the frequency as your strength and endurance improve. It's also fine to break up your exercise sessions into shorter segments throughout the day if that's more convenient for you. The most important thing is to establish a routine that you can stick with. Choose a time of day when you are most likely to be able to dedicate to your exercises. Mark it in your calendar and treat it as an important appointment. Remember, even a few minutes of exercise each day can make a significant difference in the long run. In addition to exercise and proper posture, several other strategies can help manage lower back pain. Maintaining a healthy weight is crucial as excess weight puts additional stress on your spine. Applying heat or ice packs to your lower back can also provide relief. Heat can help relax tight muscles, while ice can reduce inflammation. Experiment to see what works best for you. Practicing relaxation techniques, such as deep breathing, meditation, or yoga, can help reduce muscle tension and stress, which can contribute to back pain. Consider your sleeping position. Sleeping on your side with a pillow between your knees can help keep your spine aligned. A firm mattress can also provide better support. These simple adjustments can complement your exercise routine and contribute to overall pain management. Remember, a holistic approach often yields the best results. While these exercises and tips can be beneficial for managing mild to moderate lower back pain, it's crucial to recognize when professional help is necessary. Certain symptoms warrant a visit to your doctor or physical therapist. Seek medical attention if you experience severe or unrelenting pain that doesn't improve with rest or over-the-counter pain relievers. Numbness, tingling, or weakness in your legs or feet are also red flags. These symptoms could indicate nerve compression. Loss of bowel or bladder control is a serious symptom that requires immediate medical attention. This could be a sign of a more serious underlying condition, such as spinal cord compression. If you have a history of cancer, osteoporosis, or other medical conditions that could affect your spine, it's essential to consult your doctor about any new or worsening back pain. Prompt medical evaluation can help diagnose the cause of your pain and ensure you receive appropriate treatment. In conclusion, lower back pain doesn't have to be a limiting factor in your life. By incorporating these simple exercises, practicing good posture, and adopting a healthy lifestyle, you can take proactive steps to manage your pain and improve your overall well-being. Remember, consistency is key, and even small changes can make a big difference. These exercises are designed to be gentle and accessible, but it is important to listen to your body and modify them as needed. If any exercise causes pain, stop immediately and consult your doctor or physical therapist. We encourage you to start slowly and gradually increase the intensity and duration of your exercises as you become stronger. Remember to celebrate your progress and be patient with yourself. Taking care of your back is an investment in your long-term health and happiness. And as a final reminder, please consult with your healthcare professional before starting any new exercise program. That concludes our exploration of simple exercises and lifestyle adjustments for relieving lower back pain in seniors. We sincerely hope this guide has provided you with valuable information and practical tools to take control of your back health. Remember that managing lower back pain is a journey, not a destination. There will be good days and bad days. Be patient with yourself, celebrate your successes, and don't get discouraged by setbacks. The most important thing is to remain proactive and committed to your well-being. By consistently applying the principles we've discussed, you can significantly improve your quality of life and enjoy a more active and fulfilling lifestyle. Thank you for joining us on this journey to a healthier back. And one last time for emphasis, always seek the advice of your physician or other qualified healthcare provider with any questions you may have regarding a medical condition or treatment.